Well, Marjolein, thank you so much for meeting me today. Marjolein is a holistic pelvic floor specialist.
Yeah,
And today I've prepared some questions for you and I'd like to go through it together. So, yeah, can you say something about yourself, who you are
yes,
and what you do?
yes. Well, I'm Marjolein from the Netherlands, so only the Dutchies can pronounce my name fully correct. In the Netherlands, I'm educated as a physical therapist with a Master of Science as a pelvic therapist. And I guide women, but also men with pelvic floor disorders.
Mm-hmm.
And I coach them here in GBA also more in a more holistic perspective.
Yeah.
But the aim is guiding women with urine incontinence, with painful sex, with prolapse, with all kind of problems in the pelvic floor to help them recover.
Well, that's great. And that's, of course, what we're going to talk about a bit today, about how the pelvic floor can change during the perimenopause, what kind
Yeah,
of complaints women can have. But also, as a GP, I found it always quite funny and interesting that men are often quite surprised they have pelvic floor muscles too.
yes, definitely. Yeah, 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 yeah,
So
yeah, yeah.
I'd like to talk about
Yeah,
that a bit as well.
yes.
Also, my congratulations wearing the beautiful yurt here,
Yeah, thank you.
which is really nice, and also really nice to have air conditioning, not so hot outside.
Definitely, definitely. We need it.
Yeah.
Yes.
So as a doctor, I also work with women who are in their perimenopause,
Yeah,
and I also prescribe HRT to them.
yeah.
But can you say something about how the pelvic floor, how does that change during that crazy time of hormones to go everywhere?
Yeah. Yeah, well, what I always discover is that women, mainly in the perimenopause or after it, they develop pelvic floor disorders like urine incontinence or urgency or more prolapse. And it's actually quite strange because they feel like, oh, but my birth has been already like 10 or 15 years ago. But when we check in their history, quite often there is a cause of uh, getting pelvic floor disorders in the birth, but because of the change of hormones with the estrogen drop, and that affects the connective tissues in the pelvic
Mm-hmm.
floor. So we have the pelvic floor muscles, of course. We have connective tissues, and that is changing with the change of hormones. And the connective tissue with the muscle needs to support the bladder and also the organs in the pelvic floor. But it also has an influence of the vaginal wall. And all this can cause problems.
Yeah, yeah. It's interesting because I think a lot of women go to their doctor with these type of complaints, and I think
Yeah,
often it's not recognized
yeah.
as this is a pelvic floor muscle issue or a hormonal issue. What's your experience? Do you get a lot of women who've already been on a quest searching for an answer that they come see you, or do you have a feeling that doctors are quite good in
Yeah, in
helping these
guiding
women?
them. I think some doctors, they are quite good. They do, I think the combination of therapy is really interesting. Maybe something to help with the hormonal changes, but also to see what the pelvic floor is doing. Because, well, sometimes people are just directed to the gynecologist or the urine, how to say this?
The urologist.
Urologist, yeah. And they go just only on their specialist. But it's nice to collab, to work and on the muscles and on behavioral things and on the hormonal things and the whole package.
Yeah, yeah. Because in my experience, women often will go to the doctor if they have complaints of hot flushes, of night sweats,
Yeah,
maybe of vaginal dryness or
yeah,
recurrent UTIs. Um, I think actually a lot more is happening and changing.
yeah,
And as you said, the pelvic floor is changing.
yeah.
Could that also be a reason why maybe sex can be painful?
Yeah, yeah, yeah. When yes, of course, yeah. When because of hormonal changes, women discover more dryness. It can cause more pain during sex, and if you discover pain, what the body will do, your response, which is a normal response of your body when it's feeling pain, it will contract. And after experiencing pain, the next time you want to have intercourse, the pelvic floor is already contracting in forehand. And then you can have like the circle which you have more pain, dryness is not getting better. And I think that needs a holistic approach.
Yeah.
For sure.
Because it's interesting, during my training, after the first advice which I learned was, just use lubricant.
Yeah, that's the first. But actually, even also when you are in a menopause or perimenopause, the lubrication of your vaginal wall, when you are in sexual arousal, it will come as well, even also many years after the menopause, because it's not just something what is there always.
Yeah.
It's the lubrication comes when you are relaxed, you feel sexual arousal, you are ready to have sex.
Yeah.
But a lubrication, can help, but it does not make you feel like you are ready to have sex.
No, but that's what I find really interesting is that sex drive can be completely low, libido is low, arousal is low, but then to advise as a doctor or as a specialist, just use lubricants, this feels a bit like, as with most things in women's healthcare, that it's just been neglected and it's a simple advice from a man.
Yeah. For sure. Yeah. Because when it's lubricated, there's a hole, so you can enter. No.
Exactly.
Yeah. I think the education about how sex works needs to be in your daily life. Yeah. I think women need more time always, but especially when your perimenopause is changing your hormonal status.
Because apart from the low estrogen and low progesterone, we also see quite a lot of low testosterone in women.
Yeah.
Which is a killer for their sex drive and everything. So I really notice with the women I put on HRT. That sometimes just the estrogen and progesterone is not enough, and we actually need to add a bit of testosterone. But what is your experience in changes of the pelvic floor muscle while women are on HRT? Do you see that will actually improve the connective tissue and the muscles?
Yeah, I don't know yet, because I haven't seen women started before and after. So that would be very interesting study to do. Yeah. And I have to check in the numbers, because I'm not sure what is proven. Yeah. But I can imagine.
So apart from like the recurrent UTIs and pain during sex, what are other very typical symptoms women or men can have when they have issues with the pelvic floor?
The issues in the pelvic floor not related to the perimenopause? Well, I think very important indeed to know is that many people get the advice to train the pelvic floor muscles. But when I see women, and I can also do the pelvic floor assessment, then I think 70% of the women and the men, well, men maybe like 100%, are more overactive or tensed in the pelvic floor. So I would say make sure you're relaxed in your whole body, because when your pelvic floor is tensed, and you have the advice to train more, it only gets more tensed.
Yeah.
So relaxation is a very important thing. Yeah.
And how do you relax your pelvic floor?
Yeah, it all starts with breathing and relax your whole nervous system. I think that's the most important thing. We are so much working in our head with, I have to do this and that and that. Just relax, be in this meditation zone before you practice. Do a body scan.
Yeah. Do you think that most women or men actually know how to relax or even tense up the pelvic floor?
I think it's a very difficult muscle because we don't see it.
Yeah.
I mean, we all see our hands the whole day, and all of our muscles are started from the brain. So we have like a little computer system in our head, and all the muscles we see, they're highly programmed. But the pelvic floor, we need to we need to feel, to connect.
Yeah.
So practicing with guidance is recommended.
So are there like some self-tests you can do just to try it out?
Yeah, well, you can touch, of course, your pelvic floor. So the best parts to touch your pelvic floor. I can show you if you like.
Mm-hmm.
Not on my own body. Well, if you have the pelvic floor, for example, well, this is the pubic bone, and this is the iliac. And we go all the way down. This is the vagina, so it's the female model. But then you have the perineum. It's the little part between the vagina and the anus. But that's the part where the most muscles come together. So you can touch yourself on the perineum, and also for men, I mean, it's just behind the scrotum and before the anus. If you touch yourself and just touch and feel what's happening with the breath, when you breathe in and out, the pelvic floor must move and come back. And then you can try to squeeze, like holding up like a fart or holding up your urine. Then you squeeze and you lift in your pelvic floor. And when you release, you should feel it lowering. So that's the most easy way to feel yourself if you're able to contract.
I thought during my training, I was also taught it's if you're urinating, then try to hold the urine again. Is that something which is true? Or?
Well, I know there have been advices, but since I've been starting to work as a pelvic floor therapist, we always say don't do this. I know I think in your training this they did, but what happened when you always say stop to your urinate? Then you say to your bladder, stop. Well, you actually want your bladder to empty because we don't want to have like a urinary infection or something.
Yeah.
But you can do it once. Yeah. But I've seen women who are doing this all the time to train their pelvic floor.
Yeah. So that's not the right way to train it.
Definitely not. No. But if you are having doubts, if you're doing it right, try it once.
Yeah.
For sure.
So I think with the pelvic floor, you can have issues if everything is too tensed.
Yeah.
And women can get pain during sex. They call it vaginism. Or,
Yes.
But also, I can imagine if everything becomes too loose, and as you say, with hormonal changes, I can imagine you can get urinary incontinence.
Yeah.
And I guess you can also lose wind.
Yeah. Yes. Flatulence.
Is that quite common?
Yeah, yes, it is quite common, but people are not talking about it. So their main reason they come with me, for example, is urinary incontinence, because this is common. But then I ask them, and there's also like, yes, sometimes I'm walking and you hear my like, and yes, it's very embarrassing. Yeah.
Now I noticed that as well, that if you ask women about the symptoms, they might mention the urinary incontinence. But I've almost never had a woman who, out of herself, would say, "Oh, I'm losing gas as well." Whereas if you ask about it, they feel a bit embarrassed. But
I think they're also quite happy when you ask, because it's something that is really on their chest. They're really worried or they are bothered about it. But if someone is inviting you to talk about it, also about sex, I mean, it's also not something we don't talk that much. Yeah. And it's about to lose pelvic floor, which is causing urinary incontinence, for example. It's also mainly caused with a high condensed pelvic floor. And we can have the combination, because with the weakness of the connective tissue, we can have the vaginal wall getting weak. And the vaginal wall is a support system of the bladder and of the urethra. So if that goes weak and the bladder has more movement, then the vaginal, the pelvic floor muscles needs to support more. So it could be the connective tissues are too weak and giving too much movement. Well, the pelvic floor might be too tense. And then we can also have incontinence. And then the pelvic floor needs to be like reconnected with the computer to learn the right way. Again.
Difficult.
It's complex. And so interesting.
Yeah. So, do you have like any figures and numbers? Do you say, well, like women, if they go through the perimenopause, 50% of them will get urinary incontinence, or is that like, or is it often more to do with the birth? That's the main.
Yeah, I think, well, about urine incontinence is around 40-50%, but that's in general with all the numbers. and I have to check what recent numbers are. But in perimenopause, problems start also with the changing of the estrogen and the connective tissues and everything. But how birth has been when they were younger, if the pushing phase was long, if the babies were really heavy, that's a risk factor for developing urinary incontinence or prolapse later on.
Yeah.
So it's not totally separated of each other.
So like a more traumatic vaginal birth can be a risk factor for developing that later.
Definitely,
Because often, well, at least I as a doctor would always think it's, and I'm a man as well, so I think it's just like, oh, it's the birth causes some trauma, the tendons and everything might get a bit loose, and then women would have complaints straight away after the birth.
Yes.
But you also mentioned that sometimes they develop symptoms not directly after the birth, but actually when estrogen levels go down.
Exactly. Yeah, that's quite often. Also because women postpartum, they are more busy with taking care of their babies, and they are maybe not really noticing about their pelvic floor problems. And quite often you hear they have problems in the beginning, but then postpartum, like 9 months or a year postpartum, it gets better. But that's a good thing. In the Netherlands, for sure, there is like a postpartum check. So it's a checklist from 6 weeks postpartum to see if you have risk factors in developing pelvic floor problems later on. And if you have, you will get the advice to have a pelvic floor check and training. So the aim is to reduce problems later on.
Yeah. And is that check, who like organizes that? Because is it organized by the midwife or
this
by
is
the
organized
GP?
with the Federational Board of the Pelvic Therapists.
Okay.
I've been a member of that as well, and it has been organized by them and introduced by the midwives to give to the moms 6 weeks check.
Yeah. Do you know how that's arranged in Spain? Do they have something similar as well?
No, I think they don't do anything.
No.
Yeah. You have a 6 weeks checkup with your gynecologist. And quite often they also check how your pelvic floor is, and they even do an assessment. So would be considerable that they will give you advice if you have problems.
Yeah. But you don't work here together with gynecologists or with...
Yeah, there is a big difference in here than in the Netherlands. In the Netherlands, you have just one system, and in here you have the private system and the social security. And I only work together with the private. Yeah, so I cannot say about this in the general Spain.
Yeah, it's difficult.
Yes, it is. Yeah, but giving birth in here is way different than in the Netherlands. Well, you've been there. So you know.
We've had both experiences in the hospital and doing it at home. Yeah. So Marjolein, with like, for example, things like prolapses and stuff, is it like always necessary to operate, or are there other things possible?
I think it's definitely not the first thing to do with surgery. You can support the prolapse with a cesarean. And next to that, of course, pelvic therapy, which is education of the pelvic floor muscles, but also like how to move, like moving with belly pressure. It needs to be reduced. So it's a whole assessment of the women.
Can you say more about belly pressure?
Yeah, belly pressure. Yeah. Okay, we have the pelvic floor. It needs to support the prolapse. Well, normally the organs, but when the organs are getting lower, we have a prolapse. And if we have belly pressure, it's, for example, when you are waiting, you will give strength. And you have to move your couch if you're vacuum cleaning. Many women, they move it while they hold up the breath to make more strength to push that away. And that's the moment, if we hold up the breath, we get some pressure in here, it goes down to the pelvic floor and down to the prolapse. So it's very important to do some breath work as well to reduce this. Pelvic floor training.
So it's actually like in a gym, if you push out, you breathe out.
Yes, exactly. Yeah. It's very important. Yeah, or you have those tennis matches where you hear all those people like that's also like an holding up your breath and getting more
So
pressure.
they actually do that on purpose then.
Yeah, maybe they do. Yeah, but it's also an example that we're as therapists, we're not only working in training the muscles. It's about the whole approach. It's like how you move in life.
Hmm.
Yeah, yeah,
Hey, earlier we mentioned men and the pelvic floor.
yes.
Um, as I said before, like my experience is that men often don't even realize they have a pelvic floor, or they
Mm-hmm.
don't associate the symptoms to
Mm-hmm.
the pelvic floor. But what are common things men can have with
Yeah,
pelvic floor issues?
the most common thing is that they have to urinate quite often, and they all think, "Oh, my prostate is getting bigger," and they're always afraid for prostate cancer because that's when we are talking about men, and pelvic changes is the most common one. And but of course, a man has a pelvic floor because it's a muscle. But they don't have a vagina, and women don't have the prostate. So that's the difference. But what most common is when it's also tensed. In my experience, that a lot of men have a tensed pelvic floor. That can also cause many frequent feelings of going to the toilet.
Yeah,
Next to that, scrotal pain, chronic pain in the scrotum or around the perineum is another common part of pelvic floor
yeah,
dysfunction. Yeah, and also related with hyperactive or tensed muscles.
yeah. It's funny, but you're so right because I get a lot of men with complaints with urination. Often straight away,
Mm-hmm.
everybody thinks, "Oh, the prostate's enlarged. We're
Yeah,
going to try
yeah,
medication."
yeah.
We give medication for 6 weeks, doesn't work. Okay, let's switch, do something
Yes,
else. And if that doesn't work, I'll refer you to the
yeah,
urologist. But actually, I think often we forget the importance of the pelvic floor.
exactly, exactly.
So where,
You can do an assessment as well,
how,
the
yeah,
pelvic floor check.
how would I do that as a doctor?
Well, you can. Oh yeah, it's if you sorry, no, trek te lachen. Ik denk in plaatjes. If you investigate the prostate,
Mm-hmm.
it always goes with an internal examination through the ADS. And I don't know if you do that as a doctor, but the urologist does that for sure. And then it's easy also to ask if they can contract the pelvic floor and if they can release. And if that's difficult, you already know, okay, maybe we also have to work on the pelvic floor tension.
Yeah, yeah. I feel that nowadays
Sorry for my distraction.
I don't actually do that examination a lot
No.
anymore. I think you have to do it a lot in order to be able
Mm,
to say something good about it.
exactly. And with the blood test, it's more clear if there's a problem with the prostate.
Yeah, and especially now the MRI scan, we can deal with the
Exactly. Yeah.
prostates.
Yes.
So
And then you can measure it. It's definitely more
yeah, but
clear.
then of course you'll miss the pelvic floor
Yeah.
assessment.
Yeah.
Um, can men also have like radiating pain from if they have pelvic floor issues? Like they can say they have, for example, lower back pain. Is that something you see as well?
Yeah, well, I don't see them quite often, but sometimes compared with a chronic tense pelvic floor, they also struggle with lower back pain because the pelvic floor is working together with the abdominal muscles and the spinal cord
Hmm.
muscles. So yes, it's mainly related to each other. Yeah, and strap nerves could be around most of them around the ischial cord. So yeah.
Okay. Yeah. And what kind of sexual issues can men have if the pelvic floor
Yeah,
is
a
too
lot.
hyperactive?
Yes, a lot. Like erectile dysfunctions,
Mm-hmm.
it happens, and mainly when they are getting older, but also young men. I've seen them as well, which are struggling with problems in gaining an erection. But the most common one is an early ejaculation. Yeah, so they cannot control it, and they ejaculate too early.
And
Yes.
that's caused by everything being so tense that.
Yeah, could be. Yeah. Yes. Yes. Because in order to gain an erection, a proper erection, we need to have like relaxation to get the blood flow in. And then automatically it's with like a response of the pelvic floor. It needs to close as well. But a lot of tension can also increase the stimulation and gain a too fast ejaculation.
Yeah. Well, that's interesting because as a doctor, if some men will come with complaints like that, often we just prescribe them antidepressants.
Oh, really?
To say, "Oh, take that before you have sex because that makes the arousal a bit less. It makes everything a bit less
Yeah, but it also
sensitive."
makes your mood really
Yeah,
less.
that's
I
interesting.
would not do the drugs, well, the medication.
Yeah.
Oh, yeah. But are they happy with the medications in this case?
Often not, because erectile dysfunction is also one of the side effects they can get.
Oh,
So
really?
either
Yeah.
they might not orgasm too fast, but actually they can't even orgasm because they can't actually get an erection.
Yeah.
And they really have to plan their sex. It's about same as using Viagra. It's like you have to take an hour beforehand. So then you really have to, which is not great for creating
No.
the relaxed atmosphere if you're really busy when I'm going to take this tablet. Um, Also, another question I have, like I get quite a lot of cyclists who complain about saddle pain.
Yeah.
Is that also related to the pelvic floor?
Could be. Yes, could also be like a skin thing. But if there is like tensing in the perineal part, there are also a lot of nerves in this part of the perineum. And if it gets tense or trapped, sometimes we see like nerve trapped, but can also get pain in this part. So then it's worth to check. And we can also do like a check. Okay, how is your pelvic floor? If it's good, then it's good. And you have to go another direction. But quite often it needs some relaxation, stretches, and then
So it actually, what I learned today is that it's actually I just have to refer a lot more people to you
yeah, I think so.
instead of just trying out medication, referring them to urologists. Because my experience, at least, I'm sure you have some good ones, but my experience with the urologist or gynecologist is that they might have a little look at it, but often it was still very much on the medication bit or operating.
Yeah, and I think that's true, and it also has an economic part as well. I mean, everybody is working in their own device, and my ideal world would be like the whole co-working together and also approach someone in a holistical way, because as we have been speaking about with the sexual dysfunction, but also with urinary and the shame with this, it is not only a part of a problem in the muscles. It influences how you feel about your body and how you act and react in life. So it would be so nice if we have a bigger look at the people and more. Yeah.
Do you think every woman should once in her life have a pelvic floor assessment done?
I don't know. If you are just healthy and happy and you feel good, yeah, then I don't think it's necessary. Yeah.
So you wouldn't advise so every woman who's going to start HRT should also get,
Well,
because as
the women
you
who are
said
coming
before,
with
it's
HRT, they have a problem, and they come with you with problems in their health. Yeah. So then I would say if there is a problem related to prolapse, urinary, then it's good to have an assessment. Yeah.
interesting though. If you asked these women if they have these complaints, they often would say, "Well, it's just part of my age. It's part of that I've given birth." It's I even have women who I prescribe estrogen and progesterone with, and then later on you ask them, "Oh, how's your sex life?" and they say, "Yeah, bad," but that's just normal because the age what I have.
Yeah.
So even if we treat them, then sometimes they still consider that some things are just normal and it's just part of their life and it can't improve. So I think what I've learned and also speaking with you is that I just have to be far more proactive and ask them and because I think there's probably a lot of improvements you can offer to these women.
But of course, if they think it's normal, they won't ask for help. But if they know you can do something about it, maybe they have another perspective.
Yeah.
Like, okay, if we have the ideal world and you can do anything you want, what would your goal be?
Yeah. Yeah. But it's interesting as well because she's basically said earlier that 1 in every 2 women will have urine incontinence.
Yeah,
It's,
somewhere in their life. Yeah,
yeah.
but and a lot of women, they think it's normal, like losing, and it could also urine incontinence could also mean like a drop with a heavy cough, and they feel like, okay, yeah, it's just a drop, I don't care.
Yeah.
That's different when you have this every day, or when you run into the toilet and you're not making it in time,
Yeah.
because that's the change. Yeah.
Dankjewel.
Jij ook? Ja.